Hi, good afternoon. This is Cindy Crook. I'm the Director of Marketing here at Duncan Regional Hospital, and welcome to DRH Live. And today we're with Paula Rich, who is a licensed occupational therapist with our outpatient pediatric rehab department, and she's been with DRH 22 years, which is, we're really excited about that. So she's going to talk to you, and then we'll have some questions, but if you have any, remember, you can always type them in. Welcome, Paula.
Thank you. Hello, everyone, and thank you for joining us today. And thank you, Cindy, for the introduction and just for having me come and talk to y'all today a little bit about our pediatric rehab department. As you may or may not know, April is Occupational Therapy Month, so it's really just a time for us to just bring some awareness to our profession and just provide some education. And that's why I'm here today, is just to tell you a little bit more about the services that we provide here at Duncan Regional Hospital in our pediatric department. For those of you who don't know where we're located, we are just right across the street to the east of the hospital in our outpatient rehab department. And we are underneath the signs that say speech therapy and occupational therapy. I wanted to start by saying that I work with a fantastic pediatric team. Our OT pediatric team consists of myself, as well as 2 certified occupational therapy assistants. We have Brittany McCombs and Jamie Navarez. And we work very closely with our pediatric physical therapy team, as well as our pediatric speech therapy team. We share a lot of the same patients. We meet regularly, and we all just share just such a love and passion for the children that we work with. One of the main questions that I get asked is, why would a child need occupational therapy? They don't have a job. But what is a child's occupation? It's playing, and it's learning, and it's taking care of their self-care needs. So if a child can't do their occupation because of a motor impairment or sensory processing disorder, or delay in their cognitive skills, or delay in their social skills, then they definitely would benefit from occupational therapy services. So as far as in our rehab pediatric department, we see approximately 40 to 50 kids per week, and they range in age from newborn to 18 years old. And we see children who have developmental delays. They range from mild to severe. Some of the most common diagnoses that we work with are cerebral palsy. We work with Down syndrome, children with autism, sensory processing disorders. We work with children with learning disabilities, such as ADHD, kids who have neurological conditions. We have kids that have had strokes, kids that have seizure disorders. And we even have kids that have acquired their disabilities through a traumatic event, such as traumatic brain injury or traumatic birth. And then we have some kids that don't actually have a diagnosis. They just have developmental delays and are in need of our services. So how does the process work? We, first of all, need a referral from the child's physician. And once we receive that referral, we schedule them for an initial evaluation. And that evaluation is going to consist of standardized testing if the child can sit and participate and follow directions. And we're also going to look at their other aspects of their development. We're going to look at their hand function. We're going to look at their upper extremity function, such as their range of motion, their strength, their coordination. We're going to look at their developmental reflexes. We're also going to look at their visual motor skills, their sensory processing. If they have a sensory processing disorder or issues. And then we're also going to meet with the parent and just determine if they have any struggles or challenges at home or in school, or if they need any type of adaptive equipment or specialized equipment. For example, if they have trouble feeding themselves and they may need a certain type of utensil, or if they have trouble with dressing, they may need a certain type of dressing device, or even some bathtub equipment. Once we complete the evaluation, we're going to write up a treatment plan that's going to consist of our frequency and our duration of services, Some kids are only going to need short-term intervention, maybe less than 6 months. Other kids may need more long-term, extensive services, and we just reassess those kids every year. So once the treatment plan is complete, we begin their therapy services. Of course, we write up goals for them. Our ultimate goal for every child is just to improve their quality of life and just to improve their level of function and independence with their daily activities. Also, just to provide them with the skills that they need to be successful in their home, in their school, and just in their daily activities. So you might wonder what we do in a therapy session. I thought originally we were going to be in the pediatric sensory room, but we weren't able to do that live there today. So I was going to show you some of our sensory equipment, but we have a sensory room that's equipped with just a variety of swings and therapy balls and crash mats, and it's just an environment that we can provide sensory therapy to children just in a very safe environment. We also have a pediatric gym, and we have an infant room that it's kind of set up for therapy for our babies. We also have individual private treatment rooms that we do more of our structured, seated, fine motor tasks. We also have an aquatic room for our children that we recommend pool therapy for. So one of the main diagnoses that we work with are children who have sensory processing disorders. And we do a type of therapy that's called sensory integration therapy. These are the children that just don't process sensory information correctly. So we have kids that are what we call sensory seekers. These are the children that just really crave movement. They're very impulsive, which is definitely a concern for their safety. These are the children that just talk a lot. They like to touch and smell and feel things. These are the kids that get in a lot of trouble at school and at home. And so our therapy focuses on providing them with some calming activities that, is it still going? Okay, so our therapy is to provide them with just some calming activities, and we do that through movement and through pressure through their muscles and joints, such as like jumping and crashing and lifting and pushing and pulling activities. These are activities that are very calming to the nervous system so that the child can sit and learn and participate. The other children who have sensory processing disorders may be sensory avoiders. So these are the children that they don't tolerate sounds. These are the kids that you see with their hands over their ears. They don't tolerate touch or texture. They don't like to have their hands messy. These are the kids that they're the ones that are going to have more meltdowns just because they get easily overstimulated. So our therapy is based more on desensitizing their nervous system through providing them with just different textures and very sensory experiences. So our overall goal for our sensory kids is just to help to regulate and balance and just organize their sensory systems so that they can function in a classroom and function more independently at home. So we also work with kids with motor difficulties. We address their fine motor skills. If the child has difficulty with fine motor and they can't grasp and hold and manipulate objects well, then they're going to have difficulty in their self-care with like buttoning their clothes. They're going to have trouble just grasping a pencil or holding a toothbrush. So we do activities that provide resistance to their hands, such as Play-Doh and putty. We use clothespins and things like tweezers and tongs to just help develop the strength and the development of their hand muscles. Another thing we work on is their eye-hand coordination. So eye-hand coordination is not necessarily just a problem with their vision or a problem just with their motor, but it's where the two don't really communicate with each other. And these kids are going to have difficulty with things like just catching a ball, or even even things like just tying their shoes. So we're going to just incorporate activities that are going to include more just like visual motor activities using balls. We do a lot of ball activities with them, balloons and targets, and that type of thing, just to improve the visual motor skills. We also work on what we call oculomotor skills, and this is where the eyes don't track well. We have a lot of kids with this problem. So if the eyes don't track well, you can't track horizontally across, then you're going to have difficulty with reading and writing and just scanning across a page. If you can't scan and track vertically, of course, you're going to have difficulty with copying words off of a board in the classroom, or even just catching a ball. So we do eye tracking activities just to train the eyes and help strengthen the eyes using visual charts. We use flashlights, we use lasers, and all different types of tracking devices. We also work on the child's core strength. A lot of our kids have just really weak core muscles and weak arm muscles. So a lot of the activities we do on their stomachs. We put them on a scooter board. We place them over a ball for weight bearing through their arms, just to activate those muscles. We do overhead and resisted activities just to build the muscles in their core and in their upper extremities. We also work with handwriting. We're also just sometimes referred to as the handwriting specialist or handwriting therapist, because we do work a lot with handwriting. Handwriting is very complex. There's just a lot of underlying components to it. So we really just have to determine why is the child having difficulty with handwriting. Is it a problem with their fine motor and they can't grasp the pencil? Is it a problem with their visual motor? Is it a problem with their attention span and they just rush through their work? Is it a problem with their core strength and they just don't have the posture to sit up and write correctly? So we have to determine what is the reason behind the difficulty with handwriting, and then we just work on those areas of weakness. We also work on self-care skills, and once again, we're trying to determine why is a child unable to tie their shoes? Why can't they button their clothes or brush their teeth? And so we assess for that, and we determine what those weaknesses are. And we may need to make some adaptations. For example, if the child has hand tremors, sometimes some of their medication may cause them to have tremors in their hands, or a neurological condition, then they may need a certain type of weighted utensil or weighted toothbrush to help with that. So we're going to make those adaptations as they need. And also, we're going to provide the parent with education on a home program, because what the parent does at home is critical for the child's success. So parent involvement is just equally as important as what we do in therapy. We're not just providing therapy to the child, but we're providing therapy to the entire family. And the last thing I want to mention, as far as some of the therapy that we do, is aquatic therapy. Pool therapy is recommended for many of our patients. It's very therapeutic for many of our diagnoses, many different ages. It's a therapeutic temperature, so I think they keep it around 88 degrees, so the water is very warm, and it's good for a child who has pain. It's good for just reducing muscle tightness or joint contractures, but the resistance of the water is also good for just strengthening the muscles, working on motor control, and it's also good for children who have sensory processing issues and need that calming environment. We do so many more things than what I have mentioned, but due to time constraints, I can't really go into everything that we do, but I do hope that this information has been informative and educational. And I want to open it up for some questions that you guys might have.
Actually, I have one. You were talking about the sensory processing. So as a parent, I mean, how do I know that child has a sensory issue and they're not just being a child that,
Okay, for example, if a child is having a temper tantrum, which is very common with kids who have sensory processing disorders or who may not,
Right.
And they're having a tantrum because they just want something, and you give them that. If the tantrum stops, that means probably it's just a tantrum. It doesn't. If it's a sensory processing disorder and the tantrum, you give them what they want and the tantrum doesn't stop, they don't have the control to stop. Then I would be more concerned that there could be some kind of a sensory processing difficulty.
Oh, okay. So Karen said, you said that you come up with a plan, a therapy plan after you assess the child. So is it more likely that the child will have more than one type of therapy, or is it ever that you just feel they just need to have this therapy over and over, or do you try to mix it up where maybe it's aquatic and it's other things?
Well, our evaluations are very comprehensive and very thorough. So, and they're about an hour and a half long. And so we can pretty much determine those areas of deficit for that child, areas of weakness, and determine what type of therapy that child's going to need. And we write very specific goals, short-term goals and long-term goals, and what activities we plan to do. Now, that's not written in stone. We can also later on change up that plan of care, add aquatic therapy services, add a splinting device if necessary, or a certain type of equipment that they may not have originally in the first plan of care.
Like as they progress or something.
As they
like
progress,
that. Got it. So therefore, there really is no set amount of sessions. It just kind of depends on the how the child progresses, correct?
Yes, correct. We typically certify them for 12 months. Some of our kids, like I said, may only need 6 months or less. We write up quarterly progress reports, and if the child is meeting their goals, then we plan to discharge them, and we provide the parent or the caregiver with a home program.
And you said this is physician referred?
Yes, we have to have a physician referral in order to see a child for occupational therapy, physical therapy, and speech therapy.
So I would assume I'm correct in saying you are in contact with that physician, giving them up.
Yes,
updates?
many of our referrals come from our team pediatrician, Dr. Wise, and we actually, for the children that she refers to us, have quarterly meetings with her. We discuss our progress with the child, any challenges they may be having, anything that they may need, and it's a very productive meeting that we have.
Wonderful. And you had made the comment that the parent is very involved. It's not like you take the child and do your thing. You keep the parent very involved with what's going on, correct?
Yes, and sometimes we have the parent come into the therapy session just for educational purposes. Typically, the child does better without the parent in the room, but there are times when we have the parent come in and observe, and we do education. And then if the parent's not in the room with the child, we review the session with them. We let them know what happened in therapy and what they can work on throughout the rest of the week.
So one question was that their child is very shy and takes a while to warm up. So how do you work through that? That maybe you want to, I'm just picking something, you want to do the rolling on the ball, but that child just does not want you anywhere near them. I mean, you build that into the plan that could take a while?
Yes, and a lot of our kids have transitional difficulties, and they may not even come back with us without the parent, or we may have to, there have been times we've had to bring the activity out into the waiting room and do a little bit of therapy and gradually bring them in with us. And one thing I want to mention is our therapy is so fun that a lot of the children don't even realize that they're doing actual therapy or something that may be very difficult for them. And it does look like we're just playing with the child, but it's very organized play, and it's with a purpose. And the child doesn't even realize that they're doing therapy, and we bring the shyness right out of them really quickly.
That's great. And so let's say that you have a child that you recommend or you think it would be beneficial to have the aquatic, but the child is like really afraid of the water. Can you choose another therapy that would be just as beneficial?
We can, but typically if we really feel like the child would benefit from the aquatic therapy, we bring them into the aquatic room, which with sensory kids, sometimes it's a little overstimulating with the sound, and it's very colorful. There's a lot of activity, balls, different toys. And so we do a therapy session just in the aquatic room without getting into the water. The next session, we may sit on the edge of the water without even getting in, putting our hands or feet in. And then the next session, we may just put our feet in the water and do some activities. And then we may sit on the step of the water, and it's just a very gradual progression for those children, because a lot of the kids that have sensory processing issues are afraid of water, and that is actually one of our goals, is because they don't want to take a bath or get in the shower at home.
Right.
So we have to gradually desensitize them to that.
And so you said from birth, almost pretty young, to 18.
Yep.
18 is the oldest that you can take.
Typically, yes, 18.
Okay. And you can take it if they've had a car wreck or something like that.
We've had many kids with that have been in car accidents, that have had spinal cord injuries, that have had traumatic brain injuries. But
Put you on the spot. What's the longest you think you've taken care of a child? How many years?
I would say I have seen a child here at Duncan Regional for at least 10 years.
I bet you guys bond.
We bond very well. We bond well with the family. They become our family.
That's what's really great about you guys over there. I'm going to just twist a little bit. Tell them what's the educational process of becoming a therapist?
Well, to become an occupational therapist, you have to be accepted into a occupational therapy program, an accredited program. It is now a master's level program. So you have to have a bachelor's degree with prerequisites for the occupational therapy program, and then you have to complete the program, and then you have to pass the national board exam.
Oh, wow. Do you have to continue education?
We do continue education annually, yes.
Okay. I think it's amazing what you guys do over there and stuff. If a parent is not sure, if their child needs therapy, and I'm sure they talk to the doctor, is it possible for them to come over and take a tour of the area?
They are allowed to come over, yes. We welcome that. We've had many parents that they know their child is going to be coming to our program, and they come and they take a tour, and we show them our facility, we show them what all we have and the therapy that we provide, as long as there's not another child that is participating in therapy at the time. So we schedule it at a time where there's no other therapy going on.
That's great. Okay. Well, no questions? Okay. Paula, thank you so much. I really learned a lot, as I think our viewers have too. If you have any questions about our rehab services, whether it's occupational or just physical therapy, pediatric, adult, please call this number and keep an eye out for our next session. Thank you.